as a hospital-based bioethicist and now as a bioethics consultant, working with many different kinds of organizations, I'm really acutely aware of the challenges that senior leadership are facing in meeting fiscal accountabilities as well as upholding the values of their organizations in an ever-changing political and economic environment. In fact, I think if ever there was a time for values-based leadership to be emphasized in healthcare, it's now. And I agree with many experts who believe that the future of a healthcare system that truly cares for patients is going to be largely dependent on the continued development of principled and values-based leadership. In a work culture of caring, compassion, relationships are important. Working relationships, respectful and compassionate caring relationships, and mentoring relationships are all very much central to creating a culture of caring. Values-based leaders believe that ethical principles, values that are inherent in healthcare, should remain as foundational or fundamental to the way that they understand their role and the way they treat others. And so values-based leaders are really very necessary to ensure that the values that favor fiscal accountability, fiscal constraint, don't entirely crowd out the foundational values that we associate with healthcare. The question is, what kinds of support would be important to help promote values-based leadership in healthcare today? I think it's really important for us to have a better understanding of the kinds of ethical challenges that senior leadership are facing in healthcare. There is some early research that suggests that senior leadership in healthcare are confronted with a number of ethical challenges in decision-making that leads to moral distress. But we don't know the extent of that. We also don't know the personal impact that serving on this level is having on the individuals who have assumed these roles. And so greater knowledge will be helpful, particularly to ethics services, in understanding the kinds of resources and supports that would help them and help mitigate against the moral distress that they face. An example of such a tool is the Accountability for Reasonableness framework that was designed to help senior leadership understand the kinds of ethical principles that ought to guide resource allocation decisions. I think this is the future of our services in increasing the integration of ethics across the organization from bedside to boardroom.